One is the traditional use case within the four walls of the hospital. Traditionally, we've had a network that's already installed. You've talked about that you can even have additional networks installed for some of these biomed devices, different protocols. So they're not just TCP/IP protocols. They can be using a lot of different things to transport across there. We have VLANs where we segment out these devices, and that's primarily for security reasons, because as you said, we can't update these things. And that was a major challenge for a lot of us. Help me to understand, Anand, I'll start with you. Help me to understand how the traditional approach is changing.
The traditional approach are sort of Band-Aid and duct tape, basically, but it's network monitoring systems, legacy network monitoring systems, plus a lot of manual CLI-based intervention into systems to try and figure out what's going on. It's extremely reactive, right? It's after there's a problem and after sort of doctors and patients start noticing that there's a problem, that's when sort of everybody gets into action. But there's no proactivity. People don't know about problems before they happen. And so network monitoring systems are monitoring network elements, but nothing more. They have no visibility into the actual end devices. And as I said, it's only when people start complaining that people realize that there's any kind of issue. And you can't even verify that the problem has been fixed because, again, it's just all anecdotal. And so going forward, and today we're 2021, that approach just doesn't cut it anymore. IT wants a proactive approach. And so the type of solution that everybody should be looking for nowadays in these kind of systems is a system that basically first can collect data that describes every end client device in the network, not just the network elements like switches, routers, Wi-Fi controllers, and things like that, but actually have visibility into what all of the devices, the ultrasound machines, the MRIs, the doctor's laptops, whatever have you, are actually doing on the network and how they're communicating over the network. And so for this, different data sources need to kind of be pieced together to figure out what every end client device is doing. And so the system needs to look at packet data as an example, to look at exactly what devices are talking, what type of protocols are they talking, who are they talking to, what are the latencies and the response times of their communication. So that's the packet data portion. Then to sort of complete the picture though, you also have to talk to other systems. So like the switches and the routers to see where they're connected, the sort of location question, right? Of where they're connected, are they successfully connected? Wi-Fi, what access point are they connected to? What's their signal to noise ratio on those access points? So having sort of a picture of these devices on different protocol or different systems. Talking to network access controllers, knowing which segment they're on, which VLAN they're on, be able to sort of turn around and take action based on that. If a device doesn't get authenticated, why did that happen? What's the reason code and things like that. And then finally, be able to talk to the applications themselves and get perspective from that side. So critical applications like Citrix, VMware Horizon, Epic, right? Zoom in some cases, right? Basically, as much information that can be collected from all of these different systems about the performance and security of every single end client device. And then collecting this is one. If you just collect this, then you've just made the problem more complicated because you've just collected a ton more data. So really, you need analytics to sort of put all of this data together. And you need to be able to identify now proactively, all right, what are all the devices on my network? What are all of them doing? If they have problems, the system should automatically detect that problem and alert IT and everybody else, IT or biomed or whoever needs to solve the problem, and actually give what the solution thinks is a root cause. So, hey, this workstation on wheels is not able to communicate with Citrix because it's got really poor Wi-Fi, as an example. Or this device is not able to connect because the switch went down or something like that, right? So actually be able to provide a root cause of it and then sort of make things sort of easier and more proactive, and also have enough analytics and baseline to be able to say, this is what normal look, this has gone out of whack. And actually you fix the problem because we verified that the baseline of all of these devices is now back to normal and actually doing well. And so that's really the big challenge, and sort of going from legacy, which is kind of manual monitoring systems, CLI, things like that. Reactive to sort of a proactive, continuous monitoring where a system is actually monitoring it and doing all the analytics and correlation in the background so that what's actually provided is the actual insight. And then we'll talk about it later, but there's another element of this, of actually taking the action as well, and the system turning around and actually enacting the change.